It's important to have a public safety program dedicated to mental health because for years we've been seeing an increase in calls for service related to mental health, and we realized that we needed to have a program specifically designed to address that community need. The idea of the program began back in 2019 when we started to realize our calls for service that were related to mental health were dramatically increasing. And our officers were good at responding to calls and good at de-escalating and providing families with resources to connect them with services, but there was a gap. There was a gap between when the incident occurred and when they could actually get services. So we looked around the metro area and realized that agencies like St. Paul PD were doing the same kind of coordinated response where they were partnering a mental health professional with a police officer and meeting these community members out in their homes and bridging the gap between the incident and when somebody could get connected with services.
In Washington County, we're part of the Stepping Up Initiative, and the Stepping Up Initiative works with getting mental health into law enforcement and corrections and to be able to address mental health with resources and services. So when Washington County made that commitment, we wanted to look at getting social workers within the jail to help in that correction setting. So we were able to establish that. Next, we started looking at getting social workers in law enforcement.
When we presented the idea of creating this unit to the department, they were extremely supportive, realizing the community need was there. So thus began the conversation with Washington County, explaining what the program would be and having continued conversations with Washington County so that we could make sure that we're not only supporting the needs of Woodbury, but was there an opportunity to support the needs of other cities within Washington County. The county was able to identify a Washington County social worker that could partner with one of our police detectives, thus creating our community support team.
I got involved with the Woodbury Police Department Community Support Team in 2019. I am a detective. What that entails is that I focus on calls that are related to mental health crisis response or substance abuse or homelessness, and I look at those calls from either an in-progress crisis response standpoint or from doing post-crisis follow-up.
I work with Detective Sack and Sergeant Copel. I'm able to find resources, possibly therapy, psychiatry, things of that nature that maybe that the police don't have access to. I have access to that, and they can help get that to the client.
We have really three main functions. We respond out to in-progress crisis calls. We do post-crisis follow-up after a crisis call has happened. And then we also do case management.
When someone calls 911, if Adam and I are available and it is a mental health related call, we both will go at the same time in the same car. Adam will go in and I will wait until the scene is safe, and then I will go in and assist with providing resources or talking to the people, helping them feel heard, and just really to be there and support them.
For post-crisis follow-up, we look at all the calls that come in and we try and connect the dots. We look at the bigger picture for what's going on.
I will review police reports after they come in, and then the next day or a couple days later, then I will contact the people that were involved in the situation and ask them if they need any supports or services.
There are some cases with somebody who's experiencing an acute mental illness or it's pretty severe symptoms where we might do some case management, where we work with somebody for a period of time, and the goal is to try and help them in that situation and eventually get them connected to some longer term care so that we aren't having those repeat calls for service, or that the next time they call 911 it can go a little bit better. Otis is our therapy dog. He is the first therapy dog that the Woodbury Police Department has had. Otis responds out with us to mental health crisis calls, and he comes with us on our follow-up. And if it's appropriate and somebody wants to engage with them, we can take Otis out. And even when people are having trouble communicating or talking about what's happening, sometimes dogs have just a way of being able to provide that sense of calm and helping somebody cope and recognize the emotions that they're going through, and just be a friend when they really need somebody to be there for them. Stigma is a big challenge that we're always up against. Mental health is something that traditionally people are uncomfortable talking about in a lot of circumstances. So we try and reduce the stigma by meeting people where they're at And sometimes people aren't comfortable talking directly about what's happening, so we spend a lot of time trying to develop rapport.
It's important to be on site because of the relationships that I build with the officers. We understand how each other works. We can help the clients better when we go out because we are a team, and then we work better with the clients together when we meet with them out in the community.
We're able to spend some more time that people on patrol traditionally wouldn't have to build that rapport and to really try and work for that person's trust and their family. So we try and communicate with our patrol officers what's happening with somebody or what the situation is, so that when the next 911 call happens, our patrol officers can provide a better service and be better informed. For example, what are some talking points that will help them calm down when in a crisis? What are some topics that should be avoided? Who are the people that we can call for supports when there is an in-progress crisis response and our police officers are on the way? And what resources are they currently connected with so that we can help get them back on track and reconnected to those things that help them? One of the goals that we have with our program too is diversion from the criminal justice system when it's appropriate. So an example of this is we had somebody who was very resistant to services and experiencing a mental illness, and their family tried to do an intervention. And during the time of that intervention, this person was very symptomatic and ended up getting arrested for domestic assault. We worked with the Washington County social workers that are embedded in the Washington County Jail to coordinate communication with this individual and create a plan for their release. We ended up giving a ride to this person back to their home in Woodbury and connecting them with our social worker here who's embedded with the Woodbury Police Department. From there, it transitioned from myself communicating with this individual to the social worker working with this person and connecting them with resources and trying to work with them on some of the issues that they were experiencing. This person was doing very well with that situation and was definitely getting the help that they need. And when we have somebody like that who is getting the help that they need and that they are trying and participating in services, we'll advocate for them in the court system by writing letters on their behalf to prosecutors and to attorneys to convey that our team is working with them and that they are remaining law-abiding and that they are improving their situation and taking steps to do so.
The impact of the partnership in the community has really given officers and Washington County the ability to follow up and to make sure that there's that continuation of care, and community members are telling us that they're feeling better and feeling like the services are wrapping around and it's helpful. I'm hoping that the future is for the program to grow, for people to feel like they matter and to have somebody on their side, and just to continually provide more and better services as we can.
I think that it's fantastic that we are able to dedicate time to this and also to bring services directly to somebody versus having them have to reach out and wait. So we're able to get services a lot quicker and connect people to resources a lot faster than we ever have before.
Initially, it was just a thought on paper, a study of data. And now fast forward, here we are in 2022, and we're providing an exceptional service to our citizens and their families. So proud, extremely proud that we're able to provide that added service that's absolutely needed at this time.